Now we have a baby, right? And we like I said before, we always remember that the baby is there and the baby is a new exciting thing in our lives, and very often we forget to take care of ourselves, right? I think one of the most important things you could do is drink water and hydrate. I mean, they say drink to thirst, right? So you don't have to feel like just because you're nursing you have to drink, 4 gallons of water a day. But I mean, in my day to day, I aim for 2 to 3 liters of fluids a day. I think that that is a good benchmark. If you can drink 2 liters a day or a little bit more, that's probably where I would be. Make sure you eat. I would say coming home from the hospital the few days after, I don't even know if I ate 1 or 2 regular meals because I was just so tired and I was focused on what I was doing. And I actually really believe that that is one of the things that led to my difficulty with production of milk and with my first baby. And so really try to eat, take care of yourself, listen to your body, sleep when you can. Listen, is it going to be possible for you to sleep every time the baby sleeps? I don't know, but you should at least try. I'm not a great daytime sleeper, but believe me, you're going to be tired. If you're not sleeping, at least rest your head on the pillow and give it a shot. Nipple care is really important. I am going to be honest and say that nipples might be sore when I say sore, like they should not hurt and be cracked and bleeding, right? So use lanolin when you can. The latch itself should not be very painful throughout the feeding, but for the first few weeks, 2 to 3 weeks, you might have a lot of pain on the initial 30 to 60 seconds of nursing. That is normal. It's not unexpected. I actually think when moms don't describe that, that is the unexpected thing. So don't be alarmed if you're feeling that, but that shouldn't be what you're feeling the entire feeding. Ask for help, accept help, right? So if a friend calls you and says, we'd like to bring over dinner, sure, thank you, right? Because you are not going to want to be cooking dinner, and I don't recommend that you even try. Honestly, if you don't have enough underwear and socks to get you through a few weeks without doing laundry, place a little order on Amazon or Target and get some extra underwear and socks, because you should not be worrying about doing laundry. Anyone who wants to come visit you should be coming to visit you because they want to help you and support you, not because they want you to be waiting on them. And I think that's really important. Join a support group, join a local moms group, call me and work with me. Do whatever you think is going to help you stay calm during this time.
Talking about underwear, that's another suggestion that I would talk about is that mesh underwear that they have at the hospital. If you can get your hands on as many pairs of those as possible, take them home, because those things are amazing. Also, the really big pads, like they're like almost like Depends pads, because just with every person it's different, but you will be bleeding a lot. So I would just take home those.
Oh, and you know what they had at the hospital that I'm remembering now that was really helpful? They had pads that were like ice packs.
Yes, yes.
So if you ask your nurses, they're usually pretty good at getting you extra stuff.
Also, if you're at the hospital and they don't offer it right up front, definitely ask them, do you have a lactation consultant around? I would really like her to come by and try to get that one-on-one time with the in-house lactation consultant. And ask, for anything and everything that they have. They may have those gel packs that they can put on your nipples right there.
Yeah, you never know.
Yeah, so you just need to use your resources. Sometimes they don't come right on out and say that. So be an advocate for yourself and ask what they can provide you.
Yes.